Hello, Leon Chen here, where my mission is to increase your wealth, health, and happiness. Today, we had some very exciting news from Dr. Anthony Fauci, director of the National Institute of Allergy and Infectious Disease. Sorry, quite a mouthful. He's actually leading the war on this coronavirus, and he came out with some new studies that his organization had sponsored. The trial is called ACCT1. This is a trial that compared remdesivir versus a randomized placebo-controlled trial. The important keyword here is that it does have a placebo arm, and so there is a control. Now, the purpose of today's video is to kind of dissect out what he said and kind of translate it in plain English so that I can teach it to you guys. This video is an update to my previous video in which I went in depth into how viruses work, coronavirus works, and how remdesivir works. If you haven't seen that yet, take a look at that. That talks also about all the news headlines that led up until this point, so you can kind of put the whole picture together. I'll link it up here. I don't remember if it was on the right or on the left, but look for it. Or if not there, you can also check below in the description, and I'll link it there as well. So this trial actually took place, it began on February 21st. It pitted remdesivir versus a placebo. The sample size, meaning how many people were involved in terms of either got placebo or remdesivir, was 1,090 plus, is what he said. This is important because the larger your sample size, the more statistically powered it is. As you might hear this buzzword, it was statistically underpowered. Well, 1,000 people is actually quite powerful. You know, in the medical field, we do treat patients based off of this kind of sample size. This is the first highly powered randomized controlled trial involving remdesivir, which is why it was so important. This is an international trial that involved multiple countries in Europe, not just in the US. The endpoint meaning the what they were looking for, you know, whether it means mortality, meaning decrease in deaths, or also decrease to recovery time. So in this case, he said the statistically powered part was the recovery time, and he specifically said ability to be discharged. I just want to make it clear that the data I'm going off of is what Dr. Anthony Fauci said. I don't have the data in front of me. They're not going to release it until it's peer reviewed. So just keep that in mind, okay? This study did have a data and safety monitoring board, meaning that unlike if you watch my other video where we analyzed the study on macaques, the researchers there actually were employees of Gilead and had Gilead Stock. Now, this means that this was an independent study where these people had no conflict of interest. The results on the recovery time was 11 days versus 15 days. 11 days of recovery for if they gave remdesivir, 15 days if they did not give them remdesivir. Now, he also mentions p-value, and you might be wondering, what is p-value? And I'll kind of just translate that. The easy way to think about p-value is that you take that number as a percentage, and then you say that that is the likelihood that the results were due to chance. So that means lower is better. In the medical field, anything below 0.05 is considered statistically significant. This study was actually better. It was 0.001. Now, he also compared mortality rate of 8% versus 11%, meaning that there were 3% more deaths in the group that did not receive remdesivir. However, he did mention that this section of it was not statistically significant yet, but they're still working on that. Now, this is important because now he's presenting remdesivir as a standard of care. He is saying that this is something that they should offer to people and say, hey, there is some evidence to show that it does work. Would you like to try it, and offer to the patients? Saying that there's enough data that offering it would be the right thing to do. Now, you might be thinking, you know, the numbers, like it's like a 30-something percentage better in terms of recovery time, and the mortality rate isn't even that statistically significant. So why is this important? Well, he compared this to during the HIV epidemic. There was a drug called AZT, or zidovudine, which only showed modest results as well, but it wasn't the end game. It was just the beginning, because AZT led to further development of other drugs that eventually made it to where HIV was no longer a death sentence, and that people can actually live very long lives as long as they take those HIV medications. He thought the same thing with coronavirus, that this is just the beginning of other things that we can look into. While these results are quite modest, they're looking to improve the results by pairing this with other drugs, such as what he said, monoclonal antibodies. Now, without going into too much complicated immunology, just know that it is another way that we can possibly attack the drug and also have some synergistic effects with remdesivir. I'll give you a secret here, because if you do invest in the financial markets, you'll probably wonder, what is that monoclonal antibody? So in medicine, a way to know if a drug is a monoclonal antibody is that the last three letters will end in MAB, monoclonal antibody, AB, MAB. Okay, so an example would be like adalimumab. I heard, and I don't know if it's necessarily true, that Regeneron is actually working on a monoclonal antibody. You might want to look into that. Keep in mind, this is all speculation, which I encourage you not to do. You got to do your research, but this is just some information that might help. I'll give you further updates as they come along. Thank you so much for watching. If you like this, please like, subscribe, share this with a friend, or comment below. They all help me out. Thank you, and see you again next time.